Hello and welcome to the meeting of the E-Club of District 7710 for Tuesday, the E-Club of District 7710 for Tuesday, December 5th, and we're very glad you've joined us. Before we introduce this evening's speaker, we want to let you know about the ways you can connect with our Rotary Club. Our website is Lead With Us, that's LEADWITH.US. And if you visit the page, you'll be able to learn more about our club and also reach out if you'd like to contact us. We're also on Facebook. If you look for Rotary E-Club of District 7710, you'll find us as well on Twitter. That's Lead With Us on Twitter, and on Instagram under Lead With Rotary. So please friend or follow us. So now on to this evening's program. I am going to try to do justice to Ann Seavey. I can tell you right now that she has had an absolutely fascinating career, and I'm only going to be able to cover a small fraction of it in the bio, but Ann's already told us she's going to come back and talk about other things as well as what she's going to talk to us about tonight. So that's really exciting. And if you've had an opportunity to chat with Ann in person, she's an excellent and most humble storyteller. And I asked her a while ago when she'd be publishing her book because she has so many interesting stories to tell. Gloria Ann Evans is an RN, a family practitioner, and has her doctorate in maternal and child health. Is that right, Ann?
That's correct, with a minor in epidemiology.
Okay. Thank you. I wasn't sure I was getting the doctorate right, so I wanted to make sure.
You got it.
So, thank you. She earned her RN at Piedmont Hospital School of Nursing in Atlanta, Georgia in 1964, and proceeded to earn her BA at Butler University in Indianapolis, and then went on to UNC Chapel Hill and earned both an MS in 1983 and a Doctor of Philosophy in 1988, as I mentioned earlier. She began her nursing career in Atlanta and then joined the United States Air Force Nurse Corps, where she served as an RN with the rank of captain in the emergency department, outpatient clinic, obstetrics, newborn nursery, and surgery ward.
Yeah.
I'm getting it all at Otis Air Force Base in Cape Cod, Massachusetts, and as well with the Royal Air Force in Lakenheath, England. And spent many years working in Alaska and is still certified with the Alaska Board of Nursing, along with being an active Rotarian with the Downtown Durham Rotary Club, and serves on the board of Sister Cities of Durham and Durham Central Park. And I'm going to let her tell you about her service in the Sudan, but other key volunteer positions jump out when you look at her CV. She was a part of the Bethel Disaster Preparedness Task Force and the Volunteer Fire Rescue Squad of Dillingham, Arkansas. Alaska, I'm sorry. I don't know why I went Arkansas. Dillingham, Alaska. Sorry about that, Ann.
Oh, no problem.
She served as a medical advisor for Witness for Peace Project of San Ramon, Nicaragua, and we've been hearing a lot about San Ramon lately with some of our programs. She's a member of the Orange County Child Sexual Abuse Task Force, and she's been a foster parent for medically handicapped and socially disadvantaged children. And so all of this is to say that Ann is a truly, especially wonderful, stellar human being, and we're very pleased that she agreed to come and speak with us about her work this evening. So thank you so much for being here, Ann. I appreciate it.
Well, thank you for that introduction, Eve. It's a delight to be here. I've been doing something or another in South Sudan since 2009. So I'm happy to share with you a part of that. Eve asked me to talk about nursing and midwifery because I did some consulting work with the Ministry of Health. So I'll start with, here's a slide where in Alaska, we went to Alaska thinking we'd be there 2 or 3 years for adventure, and it turned into 15. I did a lot of different things there. In this slide, it shows me it's in Adak, Alaska, which is the farthest populated place in the Aleutian Islands. And I was the only medical provider there. They diverted a ship because they had a sick patient. And so they had to hoist me in and out of the ship on this, this whatever you want to call it there. Meanwhile, I was actually living in Bethel, Alaska. So here's an aerial view of where we were in Alaska. This is our house right here in the middle with wetlands in the backyard. So you know, it's sort of a natural thing, of course, to go from Alaska to Africa. But this dear woman is Dr. Jill Seaman. She's a very dear friend, humanitarian, U.S. hero in medicine in Time magazine. She was the 2009 MacArthur Award in Medicine recipient for her work in East Africa. I'm not humble. Jill is. She's got to be one of the most humble, self-effacing people I've ever met. She goes to Alaska and works with the Native Corporation in summer, and then she returns to Africa and volunteers her time in a project that she started. Sudan Medical Relief is the name of the project, and it comes under Cross Currents International Institute that manages the finances, which is great because Jill never could manage finances. I tell Jill that she totally ruined my retirement because I thought I would, maybe in retirement, I would go to Costa Rica maybe and plug into somebody's project and do a week or so with them on my way to the beach. But Jill said, no, you need to come help me in Ofangak in South Sudan and to help train her staff so that they would be better. Once I went, I was kind of hooked on Africa. But one of my thoughts is, well, what do I do in a retirement? I was aware that I had benefited from abundant privilege in my life. I had an intention to use education and experience to help others. I had a strong interest in international work, although I really felt like I hadn't done anything, and I really wanted to work in a developing country. Physicians, right after I retired, I was looking around for places to volunteer, and I came across an ad for a Physicians for Peace conference on the East Coast. So I flew all the way from the West Coast to the East Coast, and everyone was talking about Africa. So I thought, if you really want to do something, Anne, shouldn't you go where the help is really needed? So that was part of my motivation to go there. I felt like I had lots of education and experience, but I lacked some specific tools for doing consulting work in Africa. So one of the other things I came across was a 3-week short course in Liverpool, England, on international health consultancy. So I gave them a ring and said, hey, do you think I'd be a good candidate? And they said, yeah, come on. So most of the people there were from Africa. A lot of physicians, particularly from Nigeria. You had to be at least a master's level degree to get into the program. And their goal was the Liverpool Associates in Tropical Health is an income generating arm of Liverpool School of Tropical Medicine. And what they found in trying to do health consultancies, that there was a limited number of people who had the knowledge and particular skills, tools to do the work. So that's why they started the program. They also ask you why you're doing this program. And I told them I had a friend working in South Sudan, and I thought the country was really going to need some help. And so they said, well, you're probably going to get to go because people aren't lining up to go to South Sudan, which is true. Before the program was over, the LATH, as it's called, Liverpool Associates in Tropical Health, got a 5-year grant to do capacity building with the Ministry of Health. So this is at the end of the program. I was doing the presentation for it. Now, not everybody knows where South Sudan is. South Sudan is this little green area here. It used to be part of this bigger country of Sudan. In 2011, the South voted to break away from the North. I think it was 98.8% vote to break away. Most of the oil was in the South. The only port for Sudan was in the North. So here you've got a landlocked country, which often doesn't bode well for a country. Here is Juba, the capital of South Sudan. This country is bordered by 6 other countries. This is where I went to do consulting work with the Ministry of Health and Liverpool Associates in Tropical Health. Up here is the village that I frequently visited and where my friend Dr. Jill worked. This is the White Nile that runs through there and up north. Before that, I didn't know there was more than one Nile. The Blue Nile is what most people know. And then the country is divided because the country in December 2013, about 3 weeks after I left the country. Things were not going well there because I think it was in June or July, the president of the country just fired his whole staff and then hired back those he wanted to keep. He was really afraid that his vice president was going to try to pull a coup, and that's what he threatened that he did. In December, fighting started. The Dinka, the dominant tribe, really it took sort of tribal relationships, and it was Dinka against the Nuer. They rounded up a lot of Nuer, put them in a room and shot them, didn't allow the families to pick up the bodies, brought in trucks to remove them, and did mass graves somewhere. The fighting has continued till now. There's another effort at reviving the peace agreement, but it's just hard to know where that's going to go. I was first tapped to ask if I would be willing to be on the initial team that went into South Sudan to make an assessment of the healthcare system there. And then it got down to what I was told was the last decision, and they went with someone who had already worked in the country. And so I thought, well, that's probably going to be the way it is forever. I may as well go help my friend Jill. So I did in 2009, and this is flying into the village. There's really no roads into there. The South Olfangak is in the middle of the Sud, one of the two biggest swamps in the world. It's a little disconcerting when you fly in to see a plane like this over on one side of the dirt airstrip and another broken down airplane on the other side. But this sort of plane is what we often take in, and it landed just fine. It's lots of cute little kids around. This little guy was certainly enjoying his little dugout. And here's 3 lovely little girls that have various signs of interest and comfort in greeting someone. This is my friend Dr. Jill's mud hut, her tukel, Tukel. As you can see, there's in the back, there's a dish for the internet. So we have a couple of things there to gather electricity and power. And so that is her office. This is our sleeping accommodations, two open air tents on the ground. The river is behind. This is an old English building there in the background. And over to the right is another mud hut where we eat and cook and eat. And here's a bunch of bats that are hanging around there. There must have been, I don't know, hundreds of them in there. The first time I went in, they were really a bit disconcerting because they fly right by your ear. There was a lovely Kenyan man who went with us, and he very softly said, "No worry, they're just eating the mosquitoes." So I was relieved by that. Jill said she'd never seen anybody have any real problem with the bats. This is one of the reptiles that used to get in our mud hut sometimes. This one, I've seen them as many as 5 feet long around there. This is you may not be able to tell, but this is an ant brigade. And at first, these things are all scattered all over the place. These ants have a horrible bite. And if they bite you, you'll start pulling off your clothes trying to get away from them. But they're really painful. Not only do you have to watch out for ants, you have to keep your eyes peeled for a variety of snakes like cobras, pit vipers, black mambas. There's some neurotoxic snake that I fortunately never saw. They also have crocodiles, and I only saw a baby one, thank goodness. This is a picture of a red acacia tree. The red acacia tree harbors the sandfly that transmits cholera. And cholera is a fatal parasitic disease that attacks the liver, spleen, bone marrow, lymph nodes. It's one of the most dangerous of the neglected tropical diseases. Actually, only malaria is probably more deadly. It's endemic in 47 mostly very poor countries. And Jill is one of the world experts on cholera. And that's why she works in this area of South Sudan, because that's where there's a big band of the disease. It's treatable if you have the right lab materials to diagnose it and if you have the right medicines to treat it. But most places in South Sudan have little, if any, access to medical care, and very few of them would have the capacity to either diagnose it or treat it. This is a picture of a mother with a small child, because if people survive it, they're usually are immune. And so that means a lot of the really very sick patients are little very small children, and even babies and some elderly, depending on where they live in the country. This child shows wasting. It's very skinny. It's really too weak to smile. Often the little ones have to have tube feedings because they're even too weak to drink. The little ones in particular have so little to fall back on because they're very tiny. So they don't have much in reserve, and frequently they'll need a blood transfusion. So what do you do when you're out in the bush and you don't have a blood bank? Aha, you call on your friend. So this is our friend Dave Kapla, who's hooked up. Down on the ground there is a bag, and Jill is drawing off a unit of blood from him that'll be given to someone. Let's see. Now, when I arrived, unfortunately, there was an epidemic of Kala-Azar that was building up. At one point, we were treating 1,000 patients a day. Now, this is a village that, is kind of spread out and maybe had, 6, 8, 10,000 people. We got as many as 40,000 internally displaced people when the fighting started. In this picture, there's a man with a spear that's got blood on it and a cow. Some government officials came with gifts of cows, one for an animal sacrifice. That's what's happening to this poor cow. They had to wait for it to urinate so they could be sure that it was healthy. And when it did, then it got a spear in its side. It killed the cow and it fed some people, but it didn't stop the epidemic. And while this was going on, Jill was inside, and I saw her run from one area to another, but she was grabbing a blood collection kit because she had a little child that was really dying, and the child died very shortly after that. And Jill was infusing her blood into the child. And when I went in, after this whole scene ended outside, and the child had died, she reached over and turned off the blood that she was given to the child, and sort of quietly told me that in a little bit we would have to reinfuse that blood back into her because it might be needed for another child later. When I'm in the village, I do whatever needed to be done. I mean, this was my first time of going over there, and I had no idea what to expect. I witnessed one emergency situation where there was a critical thing going on. Jill was telling the worker that she needed a particular medicine, and he couldn't find it. I mean, the medicine box was just a jumble of medicines. So on the back of this picture, you can see little Ziploc bags that have a name of a medicine on it. It has a medicine, a syringe, so that someone can quickly grab that and not have to be rumbling around. This is a picture of evening clinic about to start, and where I'm organizing the Kala-Azar patients for admission. They have to stay there for 3 to 4 weeks to complete their course of treatments. They get several injections a day. It's a complicated system of treatment, and the green card helps us to keep track of them, and Jill ends up putting this information into the computer so she can report it to the Ministry of Health. She also does some of the best research out in a bush area anywhere, and has a really high rate of survival for an illness that's quite deadly. Here's a simple job. This is a grandmother who came to me. Her daughter had a baby, and the daughter was too weak, too sick to nurse her baby. So she would come and we had a wordless communication going on, but she would bring me the bottle that I would wash and then fill with fresh milk for her to take back to the baby. This is a night clinic. I've got a headlamp on. We usually would start the clinic around 6 o'clock at night, and then it would go until all of the patients are seen, sometimes 8, 9, 10 o'clock at night. And then occasionally late at night, you would hear a boat coming, and you just groan knowing that it was probably bringing more very sick patients. This is a little boy getting bandaged and cleaned and bandaged, which was a task that was often needed. This is a scene in the hospital where multiple patients and family are sitting around a bed. You may have 2 or 3 patients sometimes in a bed. And a lot of these people don't stay there. They come in, maybe get an IV medication, maybe some treatment, see Dr. Jill, and then go. Most of the clinics are held outdoors. This is out under the trees. A lot of the medicines are weight-based, so you need to weigh patients. And when they're little and they can't stand up, then we have a hanging scale that we hook up. And so this little tyke is being hung up in a strap to get his weight. The young woman to the right was a friend of ours from Alaska, and she was about to enter nursing school, and now she's a graduated nurse, has her bachelor's in nursing, and is working in Alaska. This woman in red is going around, so the children go to, or the patients go to wherever their treatment table is. There are groups that, because there's so many, they're divided into groups, and they go and they get checked in, get weighed, and then they're given their syringes of the injections they need. And then they wait, and someone comes around to give their injection. So that's what this woman is doing, is giving the injections. This picture is bags and bags of food that comes from the World Food Program. Because people come from many miles, kilometers away for treatment, they can't bring enough food. They probably don't have enough food to bring to be there for a month or more. So World Food Program will frequently distribute food to for the people who are in Kala-Azar treatment, and Jill also runs a TB clinic there, so they'll supply food for them too. So after, I was going to stay 6 weeks, but it turned out that because of the epidemic, I just felt like I couldn't leave, and so I ended up staying 10 weeks, and after that I left for Nairobi. I had a few days there, and I was waiting for an international flight back to the US, and while there I got an email from Liverpool. It's like, "Hey Ann, where are you? Send me your CV. We have a job we think you'd be interested in Juba." And that led to going back to the US for 1 week, shopping at the thrift shops in Chapel Hill, and then turning around a week later and returning to Juba for a 6-week assignment. There were 3 projects I did with the Ministry of Health through Liverpool Associates in Tropical Health. And the first one was the assessment of a community midwifery program in South Sudan. South Sudan had designed a program that would teach both midwifery and community, how to work within a community. And the goal was to get these people out into the rural areas of South Sudan, because most of the women were delivering either by themselves or with an untrained person from the village. And the maternal mortality rate in South Sudan is arguably the highest in the world. Supposedly 2,054 per 100,000. I think ours in the US is maybe 17 per 100,000, somewhere in that vicinity. So there was a midwife who was working with me, and then as we completed that and did here's the midwife I was working with, and here's a shot of our office where we're gathered together with the Liverpool people. And this is a presentation to the Ministry of Health and to the training, to the NGOs and non-governmental organizations that were providing the training. Basically, what was happening was we were making an assessment of how they were doing what they were supposed to be doing. The second project was the Undersecretary of Health asked if I could stay to do another project to say, well, where do we go from here? What's the roadmap now for expanding this in South Sudan? And because Carl and I had a big anniversary coming up and family was gathering in Hawaii, I said, I risked some serious problems if I stayed, but I was willing to come back. So that seemed to be okay, and I did that. The third assignment was a preliminary write-up. They did a 10,000 sample household survey to survey the health of the nation. And they invited me to come in and write up the preliminary survey, the report on that, which was a lot of fun given my public health background. And then the final report was written up by UNICEF, that major organization that designed this, so that you could compare one country with another country if they did this well. So those are the and what I would have to say in terms of nurses and midwives in South Sudan are they are very few. They're very far between. They're scattered. They're, an extremely small number. And that was a part of the report. Now you can actually access both of these two reports on the internet. If you put in my name and Midwifery, South Sudan, something like that, you'll pull up both of them. You may pull up some other things that have to do with Stop Hunger Now or Rise Against Hunger, because I tapped them to partner with me on a project. So you may pull up some things like that. But we only have a few more minutes, so I'm going to stop here. I'm happy to come back at another time and talk about the education and women's development project that I got started some years ago and continues to go on, and just came back from a visit there. So let me stop now and see if anybody has any questions.
Thanks so much, Anne. We really appreciate that. That's a really interesting overview. Does anyone have questions? Make sure you unmute yourself before you launch in. So.
Let's see if I can get out of here so I can see. Oh, there we go. Stop share.
So Anne, your first experience when you traveled, was there anything that, I know you were really well prepared, but was there anything that really surprised you when you got there for the first time?
Oh, I was totally shocked. Totally shocked. I did a series of reflection pieces, and some of which are probably on the internet still. But it was a matter of, here I am. Well, first, there's the Bat House, this Sjoukje from the Netherlands was giving me a tour, and the first house that we went to was the Bat House, where hundreds of bats were hanging around in there and zooming around. And then she showed me the Rat House where the internet was. And and I was there. I was treating diseases I never heard of on a continent I'd never visited, and had little idea with what I was doing, but it was a great resource nevertheless for Jill to have someone there. So it was quite interesting. I had no idea what to expect going there, which is probably good. Maybe I wouldn't have gone. I don't know. I'm an adventurous, so I probably would have gone anyway. But once I was there, I just fell in love with doing that kind of work, and it really fit with my goal of wanting to do something that would take a combination of my education and work experiences to try to make a difference somewhere. So one of the shocking things to me was going to Juba Teaching Hospital, and to find there that, medicines that were supposed to be refrigerated were in some little box that had a cold pack in it that wasn't cold. That they had no access to emergency medicines at night. Just so many different things that we would just take for granted in our country and just don't exist there. Meeting with the administrator of the hospital and him sort of throwing his hands up and saying, well, how can I administrate when I don't have a budget? So many places I went, people hadn't been paid. They didn't have the equipment they needed. They didn't have the medicines or whatever it was that they needed. Some of them hadn't been paid for 7 months, and I wondered why they even kept coming back. So yeah, a lot of things were kind of surprising and shocking. But one of the things that I really enjoyed in the village was that so many people, in spite of the very difficult circumstances in which they live, were so warm and just seemed to just ride with the difficulty. I think their lives have always been so difficult that they just probably don't know anything else.
Thank you for sharing that. Any other questions? We still have a few more minutes. We were late to get started, so I want to make sure if you have questions that...
I have one, if I may.
Sure, Rich. Thank you.
Yeah, this is Rich, and I'm looking at your business card, and I see that your title is Project Catalyst, which I think is a great title. But I wonder if you could say a little bit of something about Women at the Center and what, how long has it been in existence, and where are you going with this organization? I know it's associated, it looks like, with Mothering Across Continents.
Yeah.
A little bit more about that organization, if you could.
I'll tell you just a touch. And one of the interesting things to me is that this work in South Sudan was what actually got me interested in Rotary. There were some friends of ours in Alaska, in addition to Jill and I meeting in Alaska. She stayed with us at our house because we had too many extra rooms, and so we ended up housing people. But there were some mutual friends in Anchorage that came over and started doing some well drilling there. And in one of my trips, Jill said, "Ann, you have to get me a school, because if we don't have a school, I won't be able to keep my national staff." So I invited Ray Buchanan, who started Stop Hunger Now in Raleigh, and which is now renamed to Rise Against Hunger, to join me. And he came over, and we chartered a plane, went into the village and met with people. But, it's really another story, another person that started work in education about the time I started there is Patricia Schaefer out of Charlotte. And she's the founder and CEO and chief catalyst for Mothering Across Continents. She's also a Rotary Peace Fellow. And I think 2012, maybe. I'm not positive about that. I think it's 2012. But our daughter, Deanna, met Patricia, and we were still living in Alaska, and she got the two of us together, and then we started talking about working together. So I've turned over the direct management of the project to Patricia, because she has a couple of staff that work somewhere in Unity State. And so it's good to have one person supervising the same people. So basically we have a school with about 1,300 students and several buildings, and building that I put a roof on for a women's center. So a lot of things going on there now. That's a teaser for later.
Thank you.
Do you have any contact with Rotarians when you're on the ground, Ann?
I do, actually. And I, whenever I first got interested in South Sudan, I went on the internet looking for who else might be doing something, and I contacted this guy in Boston who ended up coming to Alaska, and we had a meeting there with some other friends. And he introduced me to this guy, a Ugandan, who lives in Juba. And it turns out that Emmanuel was in Rotaract when he was in school, and he is now the president-elect of his club. And there are 2 other clubs in the Juba area. And I think last year when I was there, all 3 presidents and Emmanuel met up. We met together at the little hotel where I was staying. So definitely yes. And actually we brought Emmanuel to Atlanta for the conference. Actually, we brought a couple of other Rotarians from Juba to Atlanta for the Rotary meeting there.
That's fantastic.
Yeah.
It's great to have those connections wherever you go. I think that's one of the most amazing things about Rotary, and meeting people and sharing those experiences. So,
and it was through that I thought, and also the people from Stop Hunger Now were Rotarians, and I'm like, well, this must be my tribe. Once we landed in Durham, and from where we live in the co-housing, it was just 3 blocks to the meetings. It's still walking distance from here, and it just seemed like a natural fit. So it has been a good fit. I've really enjoyed it, and feel like it's a good place for Carl and me to be.
Well, thank you for joining us this evening and giving us your teaser story. I appreciate the kind of telling of your experience of going there for the first time. So yeah. It's really interesting. So this is our virtual certificate of appreciation.
Thank you.
So we appreciate you for imparting valuable insights and inspiration as our guest speaker this evening.
I'm happy to be with you.
Thank you very much. And then let's see. We always close with the 4-way test. And MG, are you able to lead us in the 4-way test this evening? As our newest member, so make sure you unmute yourself, so we can all say it together too. So, are you ready, MG? I think you're still muted. Hang on. I will unmute. There you go. Sorry.
No problem. No problem.
Thank you.
Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendship? Will it be beneficial to all concerned? Thank you.
Thank you. Thanks, everyone. And that's Rotary for this evening.
Thank you. Good night, folks.
Good night, everyone.
Good night, everyone.
Good night. Thank you.
Good night.
Bye. Bye-bye.